All right, thank you, Chad. Coastal Kids Dentist and Braces makes going to the dentist fun for even the most nervous child. Dr. Isabel Driggers joins us with more on pediatric dentistry and how to keep your kids' smile bright and healthy this summer. As always, good to see you.
Good to see you again.
I love you guys.
Thanks.
It is true for kids who are very anxious. I have two, and my older one's very anxious. You guys are the best at making them feel comfortable. Literally from the moment they walk in the door, and there's the iPads and the games, to your excellent staff.
Yeah, that's our goal. That's what we try to do. So I'm glad we're doing a good job of it.
It's a lot of fun for, you know, maybe new moms out there who are just starting to see the baby teeth come in. When do, as parents, we need to make that first visit to go to the dentist?
The American Academy of Pediatric Dentistry recommends age 1 or 24 months. So really, as soon as those teeth start coming in, and even if you don't have teeth at that age, it's a good time to go in just to kind of learn about what to do when those teeth start coming in.
And it kind of gets them used to it.
It does. It gets the child used to it also. So they're not, the first visit's not an emergency visit.
Yeah. I was just telling you, my littlest one hit her tooth on the coffee table.
Yeah.
She's okay, but the big question that comes up, you know, all my friends are like, it's a baby tooth, it doesn't matter. But you say that's not true. Baby teeth do matter.
Yeah, baby teeth, obviously you need them to eat and to speak. Also, if you have an infection in a baby tooth, that can lead to a systemic infection, which can make you very sick.
Oh, wow.
And then finally, you need them for growth and development. So if you lose one too early, then the teeth will shift and it'll cause a lot of problems for the orthodontist later in life. So.
Okay. When do we start, first of all, when do we start brushing? Do we have to wait to the teeth, or can you brush their gums?
You can brush their gums. I always think that's a good technique because it helps with teething issues. Kids, babies love the soft toothbrush, feels good. But it's definitely, as soon as the teeth are in, you need to brush them. And actually, the fluoride recommendations have changed in recent years, and they actually recommend using fluoride toothpaste already as a baby. So you just want a rice grain size, so it's a tiny little bit, and you do that in the morning and at night.
Okay, and that answers my next question. I was going to say, when do we start using toothpaste so you can do it right away?
Yes, I mean, I'm a little conservative with it, so you don't want to go crazy. I worry people are going to do too much of it, but it has been shown to help prevent cavities. So we've had kind of an increase in cavities, and they think it might be the fluoride. So it's definitely better safe than sorry. Just make sure to use a small amount.
Just a small amount. I didn't know that.
Yeah.
You've been doing it wrong.
Yeah. A lot of people use like a big
glob, like the adult-sized glob. Another reason that makes you guys really stand out or different, I know you have several offices, so I'm going to ask you about your locations and your hours. You are very accommodating.
We do. We have 5 locations, West Ashley, Hanahan, Monk's Corner, Dorchester Road, and then Walshboro. And then we also, one of the things that does set us apart from many pediatric offices is we are open all the time. We're open on Saturdays, we have late hours, we don't close too often because we have a big team, and so a lot of people to help us out, and that helps for people that have different hours or maybe don't want to take their kids out of school.
Yeah, and it makes it easier for working moms to go in later. Not to mention you have, what, the movies that play. I mean,
we do.
I can't stress enough, you guys make it fun. Like, I wish I could go there.
We do. We try to make it easy for working parents, because I'm one of those and I know how it is, and we also try to make it fun for the kids.
Yeah.
So.
I always tell them, what's that big toy thing you have on the way out?
Oh, the big token machine?
Yeah, that's like the bribery. Like, you just go to the machine.
Looks like gumballs, but it's not.
It's not. It's little toys. They catch on quickly.
Yes.
I also want to mention your Hanahan location. You said it's kind of getting, you're remodeling or
Yeah, that was our original location, and we've pretty much, the lease runs out at the end of the summer, and so we're going to rebuild it, make it a little larger. Our orthodontic team there is really growing, so we're going to have kind of an older, less childish side for the older teens, and then still our fun, exciting side for the little kids. And then we're also going to have a surgery area there. For we do have to do surgeries on some patients, and then we're going to have like an area that's specifically for them.
That's great. So realistically, you could start seeing you guys at 1 and going all the way up through braces.
Yeah, we go all the way up to 20.
At what age do you kick us out?
I mean,
20?
Until you're kind of, you know, I'm going to college, it might be time for me to move on.
Move on to somebody else.
And we do adults with special needs also. And we are one of the main practices that does that.
That's great.
That's kind of a passion of mine, because they don't have a lot of places to go, and so we do have special equipment and stuff for adults with special needs also.
All right, thank you so much. How do we book an appointment?
You can go online and do it, coastalkidsdental.com, or you can call 818-KIDS. Either way.
Always good to see you. I got to make my next appointment.
Yeah, that's right.
Got to get the kids in there. We've got the 5 locations, Hanahan, Dorchester Road, West Ashley, Moncks Corner, and Walterboro. Go to coastalkidsdental.com for more information. And stick with us. We are back in a moment with sea turtles from the aquarium right after the break.